My name is Maura Harrigan. I'm a registered dietitian here at the Connecticut Challenge Survivorship Clinic.
Hi, my name is Scott Capoza. I'm a physical therapist for the Connecticut Challenge Survivorship Clinic. I am also as of tomorrow, be a 9-year survivor of testicular cancer.
My name is Lena Chase, and I'm the social worker in the Survivorship Clinic. I'm a survivor now for 6 years of breast cancer, and I come from a family with cancer. Pretty much everybody in my family, my daughter, my sister, cousins, we all have had cancer and have survived more or less time. So I'm able to take my experiences and what I like to think of as take the lemons, and even more than lemonade, maybe make champagne out of it. And the Survivorship Clinic is part of it.
This is an opportunity for cancer survivors to make that very important transition from being a patient in active treatment to being a person who is pursuing wellness and attaining wellness in their lifestyle. So the clinic is designed to address all different components of wellness.
The clinic entails a survivor coming to the clinic and meeting with 4 different individuals. Myself as the physical therapist, a dietitian, a social worker, and then either an oncologist or a nurse practitioner. The survivor can meet with each of us one-on-one to bring up those specific concerns that they might have. And sometimes they don't even really know what their concerns are until they start talking about things and they start kind of fleshing them out. And then each one of us as clinicians comes up with an individualized plan for that person to follow up with.
Well, I think one of the most important things to expect is to be treated as an individual and to receive a lot of personalized attention at the Survivorship Clinic. I think unlike generally what we experience in hospitals and so forth in our culture.
Well, I have the fun part because we get to talk about food and how to eat well. So people come in with often very different nutritional concerns. So it really depends on the person as to exactly what we talk about in our nutrition session. Even though everyone's an individual, there are some common issues. And one issue is a fear of eating, a fear that certain foods may actually cause cancer to return. So I try to alleviate that fear by giving people a very comprehensive shopping list of very healthy foods to eat on a daily basis. So that seems to help allay that fear. Another common concern is actually weight loss. Interestingly enough, many women, particularly breast cancer survivors, come in concerned about their weight and their appearance, and so I give them an individualized weight loss plan.
My specific role as the physical therapist in the clinic is to talk with the survivor and see where they've been as far as exercising prior to their diagnosis, during their cancer treatments, and where they are now. Some people did exercise before they got sick and then stopped during their treatments because the treatments were too much, and now they want to start up again, but they don't know how to start up, what's too much, what's too little, that sort of thing. I also have people who didn't exercise prior to getting sick, and so it's very important for me as a physical therapist to talk with them about the importance of starting an exercise plan to prevent a reoccurrence and maintain overall health. In addition to that, I do a cursory range of motion screening and strength screening, especially for the women who've had breast cancer treatments, to assess how their range of motion is of their arm and shoulder, and if they do have some deficits, be it in limited range of motion or limited strength, I can give them some exercises and stretches to start off with at home, and if they need further intervention, I can make that referral for outpatient physical therapy. Also, if the women have concerns or issues with lymphedema, again, as a result of their treatments, I can make that referral as well. So I try to work with them in the here and now, and also planning further out, short-term and long-term goals for them.
So as a social worker, I'm really wanting to know what are the issues that are pertinent to survivorship. Now that the active treatment is completed, what's going on? There's this transition period for most people having finished active treatment but yet not fully back in the world. So what are the thoughts? What are the feelings? What are the issues? How do you see yourself differently than you did before your diagnosis of cancer? How do others perceive you? And there is just a whole realm of responses that people have to that. Almost universally, there's the issue of fear of recurrence. And sometimes it's very extreme, and it can interfere with day-to-day life. And if that's the case, I have relaxation exercises that I can do with the survivor right there and then during our interview. I can also make referrals and suggestions for yoga and for meditation, and I can even do a mini meditation teaching during one of our sessions. So I would say that's probably the most common fear, but then there's all kinds of others, issues depending on the person, depending on what other crises they've had in their life, what other crises they have now, what their supports are. There are so many different variables, and basically I try to respond to each person uniquely as they present themselves.
The best advice is to do all you can, to do all you can that's in your control to stay healthy, and eating well is a big part of that. So shopping wisely and providing good food for yourself and your family is a very powerful tool and ally in your maintaining your wellness.
It's probably the best advice to give people who go through the clinic is to show up with questions in hand. I know I'm a very visual person, so if I have something in front of me, I have questions about A, B, or C, that I can bring them to the forefront and ask the clinicians, whoever it might be. So that way, you can get right into it. And again, a lot of times people will come in and they'll have certain concerns, and our discussion will lead us to something else that they weren't even thinking about, or something that I wasn't even thinking about. So I would say if you're going to come to the clinic, definitely have in your mind what you'd like to discuss. Again, try to break it up into the different specialties. But again, the conversation can go multiple directions.
So I don't like to think of myself as advice giving per se. More what I hope to do is maybe reframe what the person is experiencing so that it's not so judgmental or so negative. I like to validate. I like to normalize. I like to frame it like you're in this position now. This is part of a process. You're in transition. This is the direction that you're going to want to go. It's more like that than it is something specific, although I have actually encouraged people who have brought it up. Yes, I think going to a psychotherapist in the community on a regular basis would be wonderful. Yes, I think that yoga and meditation workshops would be wonderful. It's really picking up where the person is and then validating, encouraging, reinforcing what's positive and supportive in their lives.